Be careful with subtle morning symptoms. They could be a warning sign of diabetes. Not everyone realizes that the morning acts as a mirror reflecting your blood sugar levels throughout the night. For those living with diabetes, small signs right after waking up, such as thirst, headaches, or unusual fatigue, could be early warnings that the body is calling for help. If you or a loved one is living with this condition, don't ignore it. Pay close attention to even the slightest changes in the morning, as they might be your chance to detect issues early and manage your blood sugar before things get worse. 1. Morning nausea. Don't ignore it. It could be a serious warning sign. Waking up with an unsettled stomach, a sense of nausea like something's off inside, but you can't quite explain why. If you have diabetes and this happens frequently in the morning, your body could be alerting you to something far more serious. Diabetic ketoacidosis, DKA. DKA occurs when the body has a severe insulin deficiency and can't transport glucose into the cells. As a result, it starts breaking down fat for energy, producing ketones, acidic byproducts that can build up in the blood. When ketone levels rise too high, you may experience nausea, stomach pain, extreme fatigue, and even confusion. Though DKA is more common in people with type 1 diabetes, those with type 2 are not immune, especially if blood sugar has been poorly managed over time. Don't wait. If you experience frequent morning nausea accompanied by fruity-smelling breath, intense thirst, or overwhelming fatigue, seek medical attention immediately. DKA can progress rapidly and become life-threatening if not treated in time. 2. Numbness in hands or feet after waking, a warning that your nervous system is speaking up. Have you ever woken up with a tingling sensation in your hands or feet, as if thousands of tiny needles were pricking your skin? If this happens often, especially if you have diabetes, it could be an early sign of nerve damage caused by high blood sugar, also known as peripheral neuropathy. During the night, when the body is still and circulation slightly slows, nerves already weakened by elevated blood sugar become more sensitive, triggering sensations like tingling, burning, or numbness right as you wake up. At first, it may feel like just a minor annoyance, but over time, this nerve damage can spread and lead to a loss of sensation, making it harder to notice small injuries, burns, or infections on your feet. Why is this dangerous? Because unnoticed wounds that aren't treated properly can turn into ulcers, severe infections, or even lead to amputation if left unchecked. Advice: don't ignore morning numbness. Monitor your blood sugar regularly, care for your feet daily, and report any unusual sensations to your doctor right away. Getting enough sleep but still waking up exhausted? It might be silent fatigue caused by high blood sugar. You went to bed on time and slept through the night, yet wake up feeling like you just ran a marathon in your dreams? If this keeps happening, the culprit might not be the quality of your sleep, but how your body handles blood sugar while you rest. When blood sugar levels are too high, the body struggles to convert glucose into usable energy. Instead of fueling your cells, the energy gets trapped in your bloodstream, leaving you drained, sluggish, and low on vitality the moment you wake up. This fatigue doesn't stop in the morning. It can linger throughout the day, affecting your work, mood, and even your ability to manage your condition effectively. The solution? Listen to your body. If you frequently wake up feeling unreasonably tired, check your blood sugar right after getting up. Also, maintain a balanced diet, stay physically active with light daily movement, and don't skip your regular checkups to fine-tune your treatment plan as needed. 4. Morning headaches. It could be a sign of overnight blood sugar fluctuations. Nobody likes to start their day with a dull ache in the forehead or at the back of the neck. But for people with diabetes, a morning headache isn't always due to poor sleep or an awkward sleeping position. It may be caused by silent blood sugar swings while you were asleep. If your blood sugar drops too low during the night, your brain doesn't get enough energy, leaving you to wake up feeling heavy-headed and foggy. On the other hand, if your blood sugar spikes, the increased pressure on your blood vessels can also trigger a pounding headache. Many people dismiss morning headaches as something minor, but in reality, it's your body's way of signaling that it struggled all night to maintain balance. What can you do? Besides closely monitoring your blood sugar and adjusting medications as needed, make sure to stay hydrated, avoid caffeine late in the day, and keep a consistent sleep schedule. Light breathing exercises before bed can also help lower stress, an invisible enemy to both stable blood sugar and quality sleep. Waking up with blurry vision. Don't just blame a poor night's sleep. If you open your eyes in the morning and everything looks like it's behind a thin fog, don't be too quick to assume it's just because you haven't fully woken up. For people living with diabetes, blurry vision upon waking could be a signal that blood sugar levels were elevated overnight. When glucose in the blood rises beyond control, it causes the lenses in your eyes to absorb extra fluid and swell slightly. This change affects your eye's ability to focus light, leading to blurry vision, especially in the morning, after several hours without food, when blood sugar may have fluctuated dramatically. Although this blurriness may go away after a few hours, it serves as an early warning of potential long-term vision damage if blood sugar isn't managed properly. Pro tip: monitor your blood sugar regularly. Wear sunglasses outdoors to protect your eyes from UV rays. And if you smoke, consider quitting today to lower the risk of diabetes-related eye complications. 6. Waking up with a parched mouth and intense thirst, a warning sign of dehydration caused by high blood sugar. If you wake up every morning feeling like you've just crossed a desert with a dry, sticky mouth and an urgent need to drink water, it might not just be ordinary thirst. For people with diabetes, this is often a sign that blood sugar levels were too high during the night. When excess glucose builds up in the bloodstream, the body tries to flush it out through urine. This forces the kidneys to work overtime, especially at night, leading to frequent urination, a condition known as nocturia. You may wake up multiple times just to use the bathroom, which results in significant dehydration. The outcome? By morning, you feel extremely thirsty and fatigued. It's your body's way of sounding the alarm. Your sugar filtering system is overwhelmed. Advice: if this keeps happening, check your blood sugar right after waking and make sure to stay well hydrated to prevent fluid imbalance. 7. Unusual blood sugar spikes upon waking, a sign you shouldn't ignore. Have you ever woken up feeling groggy, with a dry mouth or slight nausea, and assumed you just didn't get enough sleep? If you're living with diabetes, these could actually be signs that your blood sugar spiked early in the morning. This phenomenon is known as the dawn effect, which occurs when the body starts releasing a surge of hormones like cortisol and adrenaline to prepare for the day ahead. These hormones trigger the liver to release glucose into the bloodstream. For healthy individuals, this isn't an issue, but for those with diabetes, it can cause blood sugar levels to skyrocket, even before eating anything. If left unaddressed, these morning spikes can make it harder to manage your blood sugar for the rest of the day. Pro tip: try checking your blood sugar right after waking up, and consult your doctor about adjusting medication doses or timing if needed. A light bedtime snack containing protein and fiber may also help keep your blood sugar stable throughout the night. In our busy lives, it's easy to overlook the small changes we experience each morning, like a bit of fatigue, a dry mouth, or a fleeting numbness. But for those living with diabetes, these aren't just minor inconveniences. They're silent warnings that the body is struggling to maintain blood sugar balance. What seem like harmless morning symptoms, blurry vision, headaches, or nausea, can actually point to something much more serious if they occur repeatedly. The key is not to brush them off. Pay close attention to your body every day, especially during those first few hours after waking, because that's when your health mirror reflects the most clearly. If you or a loved one notice these kinds of signs, don't hesitate to consult a doctor and revisit your treatment plan. Prevention is always easier than cure. And if you found this video helpful, don't forget to hit subscribe so you won't miss more important health tips, especially our daily wellness advice for those over 50. Share this video with your loved ones, because one small action today might just save someone's life tomorrow. Wishing you good health, peace of mind, and mornings filled with positive energy.